Most people who know and follow me know that I've just spent some time in hospital, and I promise there is a full video relating to that coming soon. I had an experience that I won't forget in a hurry, which was largely positive, but I have some complaints or perhaps constructive criticisms about China's hospital system. That video is coming in a few days, I promise. But while looking for some further information about China's hospital system, I started delving into how it's become such a modern and advanced industry, because a few years ago, probably any time beyond 10 years ago, if I'm honest, had I got sick, I would have jumped on a ferry to Hong Kong and sought treatment there. Now that's something I definitely wouldn't do. I don't need to anymore. I've made a comparison video in a live stream with Living La Vida Luke and Famubi on YouTube, which provides me some surprises in relation to what's happening in China. So I thought a deeper look would be good. And I found something really surprising, just announced on the 9th of October. I'm living in the heartland of medical improvements in China. And not only is it being improved, it's being massively improved. This is not insurance companies investing in medicine so they can make more profits. It's not providing medicine that keeps patients alive and therefore deriving more profits from them. It's a total and holistic approach to medicine in China that aims to prevent illnesses, detect them early when they can't be prevented, and cure them rather than manage them when they have been detected. In short, the system is completely different from the system in the West, where there are high costs, or where the costs are lower or free, there are long waiting periods. China works to prevent, detect, and cure quickly. Although experimental at the moment, there are cures for cancer, diabetes, and even asthma that have recently been announced. And it has to be asked, why haven't these things been found in the West? The US, for example, has the highest medical costs in the world, but no one's found cures for some fairly basic illnesses there, despite the high spending costs. A very recent report showed that US medical costs are shocking. The report states, and I quote, "Though spending is higher in the US, there is little evidence that this gap is driven by higher utilization or higher quality of care. In addition to having generally worse health outcomes than peer countries, people in the US are less likely to see a doctor, have a long hospital stay, or be able to make a prompt appointment for medical care. The US also has fewer physicians per capita than other countries, making access to care more difficult in some areas." End of quote. Now, why would that be? The simple answer is profit. A McKinsey report recently suggested that profit pools in healthcare in 2027 will have increased by 7% per annum, from a very healthy $583 billion to an even healthier $819 billion. Furthermore, healthcare, pharmaceuticals, and healthcare supplies top Bloomberg's lists of share increases. The health industry is a very good investment. Turning to China, where instead of long queues for hospitals, long waits to see a doctor, month-long waits to visit a specialist, and potentially year-long waits for an operation unless it's life-threatening, everything here can be done in a day or two at the most, and it's more affordable. How is that possible? Now, to get an insight into this, we have to look at what China's doing. It's the world leader in applications for patents in the health industry. It's the world leader in publications in medical journals, as well as science and tech in all industries. It has overtaken the USA, which used to lead the world by a very long way, but it doesn't end there. Guangdong, where I live, has pledged to boost biopharmaceutical and health industries into a 1 trillion RMB business. This is good for investors, but it's great for researchers and is very good for patients. There will be cross-department and inter-regional cooperation. Public hospitals here will be assessed on their support for clinical trials on innovative pharmaceuticals, as well as medical apparatus and instruments. Hong Kong and Macau will be further integrated into medical connectivity, so there will never again be a need for a Chinese person or a person like me to consider going to Hong Kong for treatment. 9 of the cities in the Greater Bay Area will implement Hong Kong-approved medical practices and medicines, further integrating the region. Doctors will be interchangeable between the SARs, the Special Administrative Regions, and the mainland, and the city governments in the GBA are being encouraged to financially support the moves all along the chains: pharmaceuticals, medical apparatus, instruments, and innovations. It's no wonder a KPMG report based around an extensive survey found that 38% of pharmaceutical companies in the Greater Bay Area were predicting revenue increases in excess of 30%. By anyone's measurement, pharma in China is huge and a huge opportunity, and this recent announcement makes it an even bigger one. Exactly 1 year ago, a report from pharmaboardroom.com suggested there were several physical challenges with cross-border integration and legislation, as well as some political challenges with the 9 GBA cities competing with each other. Both of these challenges are now addressed in this new statement that just came out. The new plan has been unveiled 1 year and 6 days after these issues were raised. Further promotion of the biopharmaceutical industry cluster's growth, strong support for Guangdong and the GBA's high-quality development, better returns on investments for individuals, organizations, and city governments, as well as increases in revenue for the region are all great news. But the best news is the benefits this will bring to ordinary people like me who turn up at their local hospital with a problem. We are the real beneficiaries. And that's all I have to say about Guangdong's improvements. I hope you look into this a little deeper yourself, because it is fantastic what's happening. And I will see you next time. Bye for now.